Welcome to Blackwood Vascular, a YouTube channel where I educate patients in real layman's terms about normal things that a vascular surgeon sees every day. I'm hoping to just simply make things very simple for people to understand, showing you guys pictures of things that we go through every day as vascular surgeons. And if you like these videos, remember this is all medical education. There's no advice here. If you want advice, go see your own doctor. But like and subscribe and follow along if you like these videos. And if you have a question or email me at blackwoodvascular@gmail.com and I can make a video for you. Here we are for the second video, and as usual, remember this program is educational, not medical advice. We will be talking about problems that related to lymphatic vessels that vascular surgeons usually manage, and I'll tell you some of them that I have seen throughout my time, and there's more. But I think probably the most important one, the most common one, is primary and secondary lymphedema. Impaired, which basically means that a lymph problem that started just a problem with the lymphatics themselves. Secondary is you had a problem which led to the lymphatics being damaged, like somebody with a surgeon cut through a lymphatic with a scalpel. That's a secondary cause of lymphedema. You have an infection in your leg and you end up with lymphatic channels being damaged. That's secondary lymphedema. You have an infection with filariasis, which people, this is the medical school one that we always learned about across in developing countries, and the parasitic infection that causes severe secondary lymphedema. But I would say probably the most common thing that we see in America, that I see in America, is lymphovenous edema. In the old days, we used to think it was just all vein disease from standing up, and the pressure in your leg causes the veins to swell, and then you end up with vein swelling and leg swelling due to vein swelling. Then people used to think, well, maybe it's not vein disease. It's more of just, this is all, and some people, this was totally not related to the veins. It was more related to the lymphatics, and the veins were actually still functional. So that can happen too. So you can have a patient with 100% vein problems. You can have a patient with 100% lymph problems. But I think by far in my experience, the most common one that I'm seeing is a little combination of both. It's like nothing is black and white. There's always this gray area in between. Some people have 70% vein, 30% lymphatic, 30% lymphatic, 30% vein, or vice versa is basically what I'm saying. And you just never know. You never know what you're going to get when people walk in through the door with a big swollen leg. I mean, to some degree, you can do the tests, and we'll talk about in another episode, physical exam of a patient's leg to differentiate between lymphedema and as well as a history. Those are the top two critical things. But lymphovenous edema, in my opinion, is so common. People with chronic, long-standing vein disease, I find that they end up over time damaging the leg and the skin due to the vein disease, due to reflux, due to a DVT, so much so that long-term, the lymphatic channels, which are so much more delicate, end up becoming damaged also, and then you end up with lymphovenous edema. So it's sort of hard long-term to kind of say, well, this patient just has one thing or the other. Other things that we can talk about, which I already mentioned, are post-surgery lymphatic leaks. And one of my attendings at Brigham actually taught me that any single time you even just so much as put a needle in the patient's groin, you could potentially be damaging lymphatics and worsen their lymphatic flow. So think about it, the needle, a 25 gauge needle, it looks like a 3-lane highway when you're the size of a person. So if the lymphatic is very small and a needle is 10 times as big, you're shoving this needle, even no matter how small a needle is, through these little tiny vessels and rupturing and disrupting all of them, even just to do an angiogram. So even minimally invasive procedures are not without risk. And then there's other things that we can talk about, which I do not see a lot of this, but I know that if you were going to a Mayo Clinic or one of these tertiary care centers, you're probably more likely to get this. But lymphatic malformations, which are people were born with their lymphatic vessels being damaged, causing swelling and pain and infections, etc. Finally, I should talk about, as a surgeon, we do a lot of prevention and management. From the beginning of, you're doing a dissection, you're cutting into somebody's skin and you're trying to find an artery somewhere, you'd be very careful, you'd be very meticulous try to find lymphatic nodes, try to ligate them, plan to put the patient on a compression therapy. And of course, if they have a leak, then all the different, this is one of the biggest challenges for especially like a groin dissection. Lymphatic leaks are very annoying, very troublesome. People develop lymphoseals where the leak doesn't just leak right out, it becomes a swelling. And there's all these new things to kind of diagnose and test. So these conditions sort of remind us of how delicate the lymphatic system is in closing and just how challenging it can be to manage when disrupted. In the next episode, we'll look at one innovative device designed to help patients with lymphovenous edema. And I'm hoping that this product becomes a thing and actually becomes something really useful for the community, because in my opinion, again, anything to help patients with lymphedema, in my opinion, I'll support, because I feel like over the years I've felt helpless. I know that there are surgeries that I have not done myself, which are pretty gruesome and pretty challenging to do. And the patients themselves, they need help. They need help. And so I'm hoping that this innovative device really does help. So stay tuned for the next episode where we discuss the DaySpring device, which is a new device I'm just learning about. If you guys found this video helpful, you subscribe to the channel. It's 100% free. It's all educational. It's all me, real. And for personal recommendations and actually medical care, go see your own doctor. Thank you very much, guys, and good luck on your journey.